Welcome back. Well, there are varying views on Cuban doctors coming into South Africa in order to help out. I want to bring in now Nehawu's Deputy General Secretary, December Mavuso, who's on Skype. December, thank you very much indeed for coming through. Very good morning to you.
Good morning, and good morning to the listeners.
Does your union have any issues with the arrival of these Cuban medical professionals?
Not at all. In fact, Nehawu has warmly welcomed the Cuban doctors who are deployed in the country. Their deployment could not have come at a better time when the infection rate in terms of COVID-19 are rising every day. So they are here to help us to stem the tide against the new infections. And we are excited because this is a carefully selected deployment of specialists in various areas, family physicians, infectious disease specialists, and so on.
So there's two issues from what we're gathering for the better part of this morning. We've been canvassing various views, testing the temperature of views around the country with regards to the arrival of these Cuban health and medical professionals. So on one hand, you have the arrival. On the other hand, you have the issue of unemployed medical personnel, professionals in South Africa. Does those two necessarily talk to each other there?
Well, let's understand the deployment. We're dealing with a pandemic. We're dealing with an invisible enemy that is, cause havoc globally. So it's an extraordinary intervention. It's not in the normal course of doing things. We understand the issue of unemployed professionals in the country, the matter we've been raising ourselves. We do know that government the past few weeks had advertised posts as part of also mobilizing more health professionals inside the country to join the existing workforce in the fight against this COVID-19. But also, it's an important thing to bring specialists, from other countries, in particular Cuba. Cuba has been a very good support in terms of health for South Africa. They've been training health professionals in our country. Today, they've trained more than 1,000 South African students. They continue to do so. So it's an effort to galvanize more health professionals in the fight against this enemy.
Let's talk about issues on the ground that South Africa is currently facing and some of the issues that your members are raising with you. We know about the issues of PPEs, these personal protective equipment, which is much needed, not only here in South Africa, but around the world. A number of donations have been received by South Africa in this regard. So money has been put forward from the Solidarity Fund as well in order to help boost up our stocks in terms of masks, the N95, the surgical mask that is so much needed by our health professionals on the front line. Is it adequate? Are people receiving these much needed PPEs? What's the word on the ground?
But there's still a very big concern and demand for the PPEs for the protection of the health workers. You will know that as a union, since the lockdown and the state of disaster was declared by the president, we've been vocal around this particular issue to an extent that we even went to court, but the court case was withdrawn after the minister had agreed to engage with us in order to discuss measures that needs to be taken, to prevent the infection of a health workforce, because you don't want your health workers, who are sacrificing their lives to save society to be infected, but also to transport the disease from the workplace to home. So there's still an outcry. We are particularly concerned that on a daily basis, workers who are infected, not just in the health sector, but also in other sectors, of our economy. We have now in the social development sector, social workers, working for South African Social Security Agency. You know that in some retail industry, there's also, such problems.
Yeah.
Whereas the Minister of Health continues and MECs to indicate that they've got enough, but we know on the ground that is not true. But also,
are there any members? Look, the healthcare professionals on the front line are not expected to work without proper PPEs. Are your members, any of them reported that they are currently working without proper PPEs?
Yes, we get such reports on a daily basis.
Currently?
We get, for instance, there are cases in KZN of emergency medical service workers. There are such cases in the Eastern Cape and in the Western Cape, where workers are expected to work or forced to work. And that's why that we raised that issue that no worker should be forced to work without protection. But there are managers who don't care for the lives of these workers, who think that they must just issue instructions. It's a very big concern. In the private health sector too, you will know the cases in Netcare St. Augustine. There are a few cases in Gauteng too. So there has been those instances, and we worry all the time when the leadership, always talks about how important these workers are, but at the same time deny the fact that there is a shortage. We don't say that there are no efforts, but it is not enough. We need to protect these workers in order to protect society.
Yeah, indeed. These workers, these healthcare professionals need to be protected because they are on the front line in this fight against COVID-19. But the battle needs also to be fought by families, by individuals as well, isn't it? Because that will help stem the spread of COVID-19. So thank you very much indeed, December Mavuso. We appreciate your time.
Thank you very much.
All right, we are running a poll, question today, asking you about the issue of South Africans accepting the Cuban doctors that will help various provinces. We're told that they will be deployed to various provinces in order to help fight against COVID-19, but there have been issues, some criticism being leveled. Social media, for instance, as well. People have come out and said, what about our unemployed healthcare professionals in this country? But I asked Mr. Mavuso as well, do those two issues necessarily talk to each other at this stage? What's your thoughts at the agenda _SABC? They've been coming through. Let's put it up, see what you